Good morning, Peter Goertz. I'm a psychiatrist. Tips for psychiatric consultations in emergency rooms and hospital wards. You never stop learning as a psychiatrist and as a human being in general. Yesterday, I was asked to see a patient in an emergency room, and she was there more for a medical reason. But during the course of the interview, I always try to ask if the patient has weapons, guns at home, and she said yes. So everything else was more in the foreground. There were other issues going on and I was distracted. And then at the end of the interview, I did not follow up on the gun issue. So afterwards, it occurred to me, wow, oh my God, I didn't follow up on the gun issue. So I called a family member and the family member didn't answer. I left a message regarding the gun to make sure the patient has no access to a gun. Then I contacted the internist, one of the internal medicine doctors who'd requested the consultation by me, and I asked them to follow up on it, and they responded. So I was able to close the loop, but you make mistakes every day, and that was one I made. I didn't follow up right away on the issue of the patient having a gun, and I was distracted by other things. Like I said, there were some medical issues going on. So it's always good when you do a consultation to try your best to make sure the patient does not have access to guns. Another issue is when you're doing a virtual consultation, you want to make sure, if possible, that the patient's alone when you see the patient. So you don't want to have a husband or another family member hidden from the camera view and realize that halfway through the interview when you've started asking about drug use, etc., etc. So you really want to remind yourself with virtual consultations to right away ask the patient, are you alone in the room? Except for the staff, maybe there might be a nurse watching the patient. And you want to then ask if there's a family member there, the family member to leave the room, and with the patient's permission, then you can talk with the family member later, for example. You always want to try to get collateral information, and that can be a little tricky nowadays. Nowadays, there's so many calls that are spam calls, unnecessary calls, and people often don't answer the phone. So I've had that experience quite a few times when I try to call the patient's mother or family member or spouse. They just don't answer because people are so used to, myself included, people are so used to getting nonsense calls, they just don't pick up if they don't recognize the number. So what I've found helpful is to ask the patient to text the family member before I call, let's say, from the patient's phone. So ask the patient to contact the family member from their own phone via text or call and let the family member know I'm going to call. Let's say if they didn't pick up when I called the first time. So that's one method to try and make sure you speak with a family member if they would otherwise ignore your call. Another issue that can come up is language, and I had that come up this past week when I saw a patient who spoke English himself, but his wife did not speak English. So whether it's for the patient or for someone you want to get collateral information from, you do want to use an interpreter if necessary. And if you have any feeling that the patient may not speak English that well or may not understand English that well, it's better to use an interpreter and really get more of a picture of what's going on with the patient. So with that patient, what happened was I called. It's very easy. We have interpreter service available pretty quickly on the phone. And I just had the interpreter call the patient's wife, and I was on the phone too. And we spoke with the patient's wife in her own language. And you want to, when you do a consultation, you want to also try your best to get records from other hospitals and clinics outside of your system. And that's often possible nowadays with technology. I actually have access sometimes far from always, but sometimes I have access to records from other hospitals and clinics, which can be very useful because let's say the patient was last seen in your system maybe 5 years ago, but you see a presentation to the emergency room from 2 days ago in another hospital system. So you really can use that information. Another thing that can trip you up is not getting a pregnancy test. So any female of childbearing age, no matter how young or how old they are, could be in their 50s, could be very young, you want to get a pregnancy test. And one major reason for that is because psychiatric medicines might interfere with the well-being of the baby, fetus, or embryo even. Another thing that's important to pay attention to is the EKG. So you want to, it's not always necessary, but if there's an EKG, you want to look at the EKG. If there's a chest x-ray, I always look at the chest x-ray. You want to look at lab work if there's lab work, check the liver, kidney. All that is important to know if you're going to potentially prescribe medication or even give medication as needed. And if at all possible, if there's lab work, you want to get a urine toxicology screen. And that can be very helpful in making a diagnosis also. Let's say last week I had another patient come in quite psychotic, and it turns out the urine, as far as I remember, had amphetamine in it. So that might have been an explanation, or at least a contributor to the patient's presentation with psychosis. You want to check, in America, you want to check the prescription monitoring profile or prescription monitoring program of your state. They have a website. And if you live close to a neighboring state, it can be a little tricky because often, not infrequently, patients get prescriptions in one state and another state if they live close to the border of the state. So I often, or at least at times, I need to check the prescription monitoring program websites of 2 states for a given patient. And that you don't always have to do for consultations, but if you have any suspicion or any knowledge that the patient has been prescribed a controlled substance like a benzodiazepine or opioid, you want to make sure to check that website. Another thing that's very important when you're doing consultations is to pay attention to medical issues. Yesterday I had a patient, an emergency room consultation, and the patient was felt to have maybe had a stroke. He also was a very heavy alcohol user, and it seemed that he needed to have a benzodiazepine taper, so a Librium taper, a Valium taper. On the other hand, we wanted to see if he had a stroke or not, and wanted to be able to examine him and wanted him to be awake enough to cooperate with a neurologic exam. So we didn't want to give him too much of the benzodiazepine for the Librium or Valium taper because we didn't want to sedate him in order not to obscure neurological findings on the exam. So it's a balance, and medical issues are really important, so you don't want to obscure them. Thank you.